Christina. I'm the Executive Director of Voices for Healthy Kids at the American Heart Association. Thank you, CSPI, for inviting us here today and for all of the work that you do each and every day to make our communities healthier. At Voices for Healthy Kids, one of the ways that we try to contribute to advancing health equity and racial justice is by supporting advocacy campaigns at the state, local, and tribal levels. In 2021, sugary drink policy is at the heart of our work. From policies that support healthier kids' meals, no-cost drinking water access in schools, equitable sugary drink taxes, and fighting off statewide preemption of local sugary drink taxes, we've got our hands full. Already in 2021, sugary drink tax efforts in Hawaii and Washington state have not advanced for consideration. But I refuse to say that we've lost, because these are meant to be long-term fights that can take many years to pass. And every month that we get to spend building community ownership and political will get us that much closer to victory. Nobody ever said this was going to be easy, but change can happen within one generation in public health. Case in point, when I was born, my mother was allowed to smoke in her hospital room when she held me during the first days of my life, and she did. A few years before my kids were born, it was totally normal to walk into a restaurant, office building, or state house and see people smoking indoors, and most high schools had designated smoking areas. My kids, who are now college seniors, have grown up believing that indoor smoking was not good, not allowed, and even a bit appalling, because it was just never a normal part of their existence. If we do our jobs right, their children will grow up in a world where it's simply not normal for children to drink sugary drinks, because we will have sufficiently engaged communities and decision makers to change policies, systems, behaviors, and belief. Before I go, I'd like to invite you to check out our new science-based sugary drink message research guide at voicesforhealthykids.org. Thanks again to CSPI. We appreciate you as collaborators and friends and are honored to be part of this 2021 Sugary Drink Summit. Thanks.
Welcome and good afternoon. I'm Mike Nutter, former mayor of the city of Philadelphia, served nearly 15 years on Philadelphia City Council before becoming mayor, and I'm the vice chair of the board of the Center for Science in the Public Interest. Could not be more excited to be with you today. I want to welcome you to this now closing plenary, but I know that it's been a quite exciting and fascinating 3 days of events and presentations. We kicked this summit, if you will, off by focusing on voices from the community that highlighted so many compelling stories about the history of sugar as a commodity and the impact of sugary drinks on communities of color in particular. This closing plenary will bookcase, or better than a bookcase, it will bookend the summit by bringing voices of experience and inspiration to the forefront. We'll try to tackle a number of issues in this session in the form of a conversation, and we're going to explore with these great leaders that I'm about to introduce what we can share and specific insights that have come from their experiences as well. All of these leaders, all of them, have done and continue to do some groundbreaking work all across the United States of America. And I'm sure not only do we have much to learn from them, but more importantly, they're willing to share. So let me introduce my panelists and this great, great team. First up, Dr. Yalandra Hancock, and she will talk about her experiences. She, of course, is a physician, is an MPH, an MD, and of course, her bachelor's studies in undergraduate school, a mom, a physician, and a public health champion. And then, of course, we have Gloria Ann Begay. She is a Navajo educator, policy advisor, mom and grandmom, and a tireless advocate for equity in health and food in local, tribal, and at the national level. And then certainly, last but certainly nowhere near least, is Del Monte Jefferson. Del Monte works with a community-based organization and is executive director of the Center for Black Health and Equity, and directs their programs and is a 20-year champion in these areas. And so that's our panel this afternoon, and we're going to ask them to make some opening remarks. We're going to jump into a lively conversation, and I want to kick things off with Dr. Hancock. Dr. Hancock?
Thank you, Mayor Nutter. You're for my forever mayor from Philadelphia. Thank you to CSPI for the opportunity to not only present but to close the work out. I truly have the joy of working in all the areas that I grew up dreaming of, as a physician, as a mom, as a public health person, and doing this work and really working in partnership with the community to influence policy. My claim to fame right now, as of 2021, is that I was able to assist the Prince George's County Council in passing the first of its kind in the legislation that we passed, the Prince George's County Healthy Kids Meal Bill, which is the most far-reaching legislation in terms of a children's meal bill, including both the beverage and the food. So the default being the healthy choice for beverages and for the side, and then eventually establishments being required to provide at least one meal meeting USDA guidelines. And clearly, I did not do it by myself. Part of the conversation that I hope to have today is the discussion around partnerships and really connecting with community and prioritizing the community and allowing them to have really the first voice in how we move forward in getting legislation like this passed.
Dr. Hancock, thank you so much. And Gloria Begay, let us hear from you.
Yes, thank you. And I am so happy to be here to share our success stories out from Navajo Nation. And we are a large tribal community residing in the states of Arizona, New Mexico, and Utah, and part of Colorado. And as you can see, our reservation is 27,000 square miles. It's equivalent to the state of West Virginia. And we started our journey with our Healthy Dene Nation Act back in 2014. And just a couple of months ago, we renewed this tax legislation that imposes a 2% tax on unhealthy foods and beverages on the Navajo Nation. And in the past 4 years, we have collected $7.58 million, and those monies have been returned to our 110 community chapters. And so these chapters lie in these colorful, what we call agency regions. And you'll notice that the revenues have varied, and all the revenues that are collected from what we also call the junk food tax goes back to the 110 communities for what we call community wellness projects. And in the past 4 years, we have created more than 1,300 wellness projects. And now that we have renewed the tax to be indefinite, from our tribal council and our Navajo Nation president, we are going to be enjoying future revenues to create more health projects. And it is all based on health disparities out on Navajo Nation, looking at diabetes, cancer, heart attacks, and now COVID. So those give us a justification to have the 2% tax imposed on unhealthy foods. And one last comment, the council wanted to have a balance of food tax, so they have waived the 6% general sales tax on fresh fruits, vegetables, and water, so that it will encourage Navajos to buy fresh and nutritious foods on the reservation. And then, of course, the 2% junk food tax is to discourage Navajos from buying unhealthy foods and beverages. And we've seen a 3% decline in the tax revenues, and that just gives us an indication that our people are making better choices of buying more healthier foods and less unhealthy foods. So I just wanted to share that message with everybody, and I have enjoyed meeting some new folks here, and congratulate the conference organizers and folks with this opportunity to present our projects. Thank you.
Well, that's great work, Lori, and a perfect example of combining incentive and disincentive to literally affect choices that people are making and their behaviors. Del Monte, Jefferson, please tell us a little bit more about the Center for Black Health and Equity and a particular focus for your programs to benefit people of African descent.
Okay, Michael, thank you. Thanks for having me here. Thanks to CSPI for inviting me. And I can kind of see why, I was invited here at this point. Our organization, the Center for Black Health and Equity, we used to be called the National African American Tobacco Prevention Network because our primary focus was tobacco. But that has since evolved. And last year, we changed our name to the Center for Black Health and Equity because we also address cancer and HIV and COVID-19, and now we're even addressing food insecurity. And so it's interesting as I've been attending the summit over the past few days and just listening to the similarities between the way the tobacco industry has targeted African Americans over the years, and how the food industry is now targeting these same communities, marginalized communities, people of color, Black and brown communities. And so it's very similar. Menthol, that what we work on, we want to ban the sale of mentholated tobacco products. And we want to ban it because the tobacco industry targeted our communities for decades. And now, back in 2009, the FDA failed to ban the sale of mentholated tobacco products or banned menthol completely, even though they banned other flavors. And so we've been working to get that done. And so we focus on menthol because menthol is focused on us, predatory marketing to our populations, dense advertising in our communities, price discounts in our communities, donations to our organizations and church officials. All these are predatory marketing tactics. And we're seeing the same thing as I've been listening over the couple of days. The same thing happens in the food industry, the exact same type of predatory marketing. And so what we're saying is, and what we've worked on, not addressing this predatory marketing that's happened by the tobacco industry and even the food industry is an example of systemic racism. It's systemic racism because systemic racism is when there is no accountability in our systems to stop this type of predatory marketing from happening. I've listened to some of the presentations and I was just on that session about menu disclosures and I understand all the legal aspects of it in the First Amendment, but we have to call out systemic racism when we see it. And we have to hold systems accountable for doing it. And I'm looking forward to a lively discussion. Thanks, Mike.
Well, thank you, Del Monte. And it will be a lively discussion. But I have to tell you all, as I was sitting here listening, this was like a stroll down government, public policy, politics, memory lane for me, and some of the battles and challenges that I got involved in as a city council person and as the mayor. But that'll be another panel for another day. I'm the moderator, not a panelist. But I want to ask some questions. A couple of them may have multiple parts to it. We're going to try to get as much in here as possible. So let me start with back with Dr. Hancock. First and foremost, please tell us about some of the lessons you learned from the success that you had. But we always know that even success often can be at least a two-sided coin. And so I also want to hear about maybe some of the pitfalls, some of the areas that maybe if you had a second chance, you wouldn't do again. And what led to successful communication strategies and how you built support?
Thank you so much for that several part but excellent question. I've been able to work with elected officials over nearly a decade, actually over a decade now. It's been about 12 years working with the DC City Council and the Prince George's County Council, and being able to observe the processes in which health policy is passed, right? And being able to see things and learn things along the way so that when given the opportunity to sort of lead the charge in this particular legislation, I was able to bring into it some of the things that I had observed and heard. I'm a perpetual student. And there were three key learning lessons in our success. The first was there is no I in team. It has to be a team effort. It has to be a partnership between our elected officials, between our health professionals, the business industry, and the community at large. excellent health legislation, particularly battling big food and big soda, does not start and stop in the city council building. It has to be a fight that's taken to the streets, because that's what the industry does. The industry will blow your phones up, but they will also go to social media and all of these places where the community exists, where they live, and then they will be the ones calling you, compelling you to vote against this legislation. And so what we decided to do in Prince George's County was to really create a strong coalition that was inclusive of CSPI. So I will forever be grateful to CSPI for all of the work that the organization does, but particularly the role that they have played here in the DMV as it relates to health policy. So CSPI, it was the American Heart Association. They are, forever champions of mine, not just in terms of heart health, but in terms of holistic health. They don't limit their campaigning, their work, their efforts to just heart health. It's comprehensive. It was community partners here in Prince George's County, our Food Equity Council. We made sure that we also went to Sugar Free Kids, a nonprofit organization. So nonprofits were represented, but we also included community members. I could not be a professor of public health in the community-oriented primary care division without making sure that we had community members as equal partners. And there was a brother by the name of James Tate, who's a health minister here in Prince George's County, who is phenomenal and has an incredible testimony. And so those were the people we pulled together. I brought in George Washington University, where I'm a professor at the Milken Institute School of Public Health, so that we would have folks from a variety of backgrounds speaking to the initial stages of this legislation. We didn't wait for the legislation to be written and then get everybody's opinion, because then that means I was an afterthought, right? We were very purposeful in the engagement. So it was partnership. The second is really having not just an appreciation, but a commitment to health in all policies. It's elected officials like yourself, Mayor Nutter, Council Member Sidney Harrison, who sponsored this bill and led the charge and the fight to the finish to get it done. We'll talk hopefully about some legislation that I'm helping to get pushed forward in DC. So councilwomen like Brianne Nadeau and Mary Che, they see the vision and they prioritize health in all policies, such that they are very purposeful in creating health policy that affects change, such as this healthy kids meal bill and sugary drink excise taxes. Like we have those partnerships. It's absolutely incredible. And then it's having a full appreciation of the bombardment and the persistence of big beverage and big food. I tried to explain to my elected official partners, be ready, stay ready so you don't have to get ready. They underestimated the barrage of phone calls, emails, and just assault that would take place the minute there was a mention of this legislation. So those were the lessons in success. And then again, as I mentioned before, success leaves clues. So we paid attention to Philadelphia. We paid attention to Mexico. We paid attention to other municipalities who were very successful in having this legislation implemented. In terms of sort of the growing pains, one of them was making sure you create the narrative before the industry has a chance to do it, right? Trying to make sure that we not only create the message that speaks to what we do, but that it's reflective of community voice. What I would say, sort of thinking in reflection, I would have had community voice way at the start. My brother James Tate was there at the table, but I would have wanted mothers, fathers, children right from the start to engage. We included them later on, but the legislation had already been written. I think it would have been even more powerful, even though it passed unanimously, 11-0. Strong work, Prince George's County Council. But I think it would have been even more amazing had community been able to take pride in their partnership in the process as well as the final product.
You know, Doc, you're a tough competitor. I mean, you got 11-0. I mean, you know, what more do you want? What more do you want?
Well, you know, I'm an A+ student. I can't help it.
I hear you. You're going for it. Gloria, I'm going to ask you probably a somewhat similar version with a couple twists in it, given the nature of your work. I want to hear about some of the success stories around the use of the revenues. But I am really fascinated by this disincentive model that you all have put together. And just what was that like? Tell us about that process. I'm going to assume that it wasn't easy, and then the battles around renewal and some of the impact, as Dr. Hancock talked about, some of the impact of the industry. This is an industry that will fight you, claiming to want to protect people, while basically they're just trying to protect their own pocketbook. Tell us more about your experience.
Okay, thank you very much. We started our journey actually back in 2011, and it was the Navajo Indian Health Service people that recruited us, grassroots Navajo people out of the communities to come and meet and organize that, what we call the Diné Community Advocacy Alliance. And we had 80 members, and they were mothers, fathers, people that also were in the health professions. So we had a lot of, like Yalandra said, partners that joined us. And when we started our journey, we had to work with our 110 communities. We had to go in and devise the resolutions, and we had to show those supports and take it to our tribal council. And we did a lot of research and study, gathering the statistics and data to show the need for, the health issues and the reasons why we wanted the tax to be imposed. And when we finally went to the council with all of our resolutions and materials, they were very cooperative. They had food lawyers, Justice Department lawyers, and different people make the legislation with us. And as long as we had up-to-date health data and statistics, they grasped onto our resolutions. And we had to go through the standing committees of the council. We had to go present to the budget, to the law and order, to all these different committees. And we had to go, we went and met with the full council 6 times, and then 20 times to all the subcommittees. And so we had to keep retelling our stories and bringing in champions, other champions. And so, in fact, the former president vetoed our first legislation. So we had to start all over again. And it took almost a year to start all over again with all the resolutions and the subcommittees. And so it was a long, drug out fight. The Coke Company was the biggest opponent to us. They bought the services of one of our Navajo lawyers. He'd go up and down the legislator's desk and put out their Cokes and donuts, and it was just appalling. And then we'd have to come and counter that with nutritious foods for their lunches and stuff. And so, we really had to do a lot of education of our lawmakers. And so sometimes they'll say, we'll come in and present for 30 minutes, and then we'd be there for 4 hours. Or we, in the renewal process, we were there till midnight, and in several cases, and we had to really jam pack going through that whole legislative process within 2 months. And normally it takes about 6 months. But we were able to educate the new council delegates about our wishes, and they finally reauthorized the tax legislation. And it was nice that the council finally got so educated. They supported both the waiver of taxes on the healthy foods and supported the 2% tax on junk food. And that was the other issue when we went to communities. The communities sometimes said, some of the grandmas would come and say, well, I buy my love of my grandchildren with popping and candy. We just would roll our eyeballs around, and we'd have to educate again. But what was happening though is when we were out in the communities with support resolutions, we were training them on the health data and statistics. And then they would say, well, can you come back and teach us more? And so we had, by then, really persuaded our community people to support it, right to their council delegates. And we finally got the health tax passed. And so we had a lot of troubles and stuff, but we persevered. And We had other funding sources jump in and give us funds. We had to do economic impact studies, and we even set up more social media billboards. And it really was just wonderful that we got a number of support from our community people and legislators at the end of our story. And it's still going on.
Sure. And Gloria, just touch on, if you will, of course, you've had these successes. You've also generated some pretty significant revenue. How is the community benefiting from all of that fight? And that just your retelling of the story of the journey made me tired. You all really put in a serious effort there.
Yes. Some of the projects that have come out are various different categories. There have been community gardens, school gardens, some of the more popular running and walking trails that, are low maintenance costs. It could come from small community budgets versus large community budgets. Some communities got like $100,000, and they would start working on wellness centers, bringing in physical equipment. There were also health education, food demonstrations, promoting traditional foods. Also, even our Navajo language and our culture. We did mental health projects. So there were numerous, all kinds of projects. Waste management. We're concerned about our environment, and so we've been doing clean water, waste management kinds of projects, and taking a look at our community also as part of our health system. And so it did reflect holistic health issues.
Very good. Very good. To our listening audience, I want to encourage you to send us in some questions. We're going to try to answer certainly questions for the audience. Of course, as a moderator, I have some questions, but certainly want to get community voices into the conversation. And so I'm sure you know how to do that. We've been on these virtual platforms for about a year, so I know everybody knows how to do that by now. Del Monte, you touched on it, you lift the veil, but I want to rip the Band-Aid off on this issue of, and I'd really like you to go in on it. Why are the food companies, the beverage companies, the tobacco companies, why are they literally assaulting Black and brown people of color across the United States of America with these products? You've been in this world and in this work in the trenches for 20 some odd years. Please lay it out for us. Give us the word.
Well, I really wish, Michael, that I could say that it was just the tobacco industry, that it was just the food industry. I wish I could say that, but we see in the news, if we turn our TV on and see in the news, we see that our communities are assaulted daily from the judicial, the law enforcement system. We see that our communities are assaulted from banking industries and redlining of homes and districts in communities of color. We see that we are assaulted, daily in the health industry. Just look at what's going on and what has gone on with COVID-19. So I wish we could say it was just the tobacco industry and the food industry, but it is not. It's so much bigger than that. I mean, the systemic racism that we face is rampant.
Mayor Nutter, can I add to that?
Sure, absolutely. We're about to jump into the full on. We're going to get it on.
But let's gloves off. Part of it is knowing the power of the Black dollar, right? We make up 13% of the population, but let an African American person identify something as what's hot and what's not, everybody wants it. And so the beverage industry, the food industry, they know that if they show up at the Essence festivals and sponsor them, right? If they show up on billboards, if Calvin is working at McDonald's, that's going to make us feel that they are in partnership with us because we are very relational people. And so if they position themselves to be in close proximity to us in the same way that they did during the civil rights movement, they literally had meetings to discuss how they would place bottles of Coke in protesters' hands as our grandmothers and grandfathers put their lives on the line for us all to be able to have equitable access, right? It's the same way they've tried to interject themselves into the Black Lives Matter movement. If Black lives truly mattered to Coke, to Pepsi, and everybody else who makes money off the Black body being sick, then they would not push their poison. They would push Dasani instead of Coke. These are the kinds of conversations that we really have to have. They understand the power of and the loyalty that we as African Americans and Brown, Native American, and Latinx communities, once we are tied to a product because we're very relational, they know that you're not going to like, I was first introduced to Pepsi when I was 5, sitting next to my grandmother. And I continued that habit until I was in college and only stopped it because of a calcium deficiency resulting from drinking so much Pepsi. But I was committed to it because it was the family affair that we had with soda. We have to end these relationships and recognize that Coke has no business in essence, because this is what's driving us to our graves, and doing it early.
When I was,
and you talk about,
go ahead.
no,
Go
I
ahead,
was just
Jamal.
going to say, you talk about the Essence Festival, the Cool Jazz Festival. I used to go to those Cool Jazz Festivals. I had no idea. The play on words, they call it the Cool Jazz Festival. So we're thinking, oh, this is just cool, it's cultural, but they're selling their cigarettes. They've got the sampling vans. They're giving them away for free. You can walk away with all kinds of merchandise. And yes, I'll admit, I had the hat, I had the shirt, I had all that stuff because I was at the festival. And I didn't even put the two and two together at that point in time. I was much younger. But just think of how subtle that is. Think of how many folks, go to those conferences, go to those events, come away with the merchandise, and they're walking billboards for a product that's going to kill.
I was going to mention when we put forward the first version of the sugar tax in Philadelphia back in 2010 and then 2011, with massive opposition, all kinds of stories, none of which were based on any fact that people were going to lose their jobs, companies were going to go out of business, all these tales, puppies are going to jump off of bridges. I mean, it was just every possible horror story. And then we got a call one day to say that the beverage industry was willing to make a $10 million contribution to the city of Philadelphia for some health initiatives if we would drop our work on the sugar tax. Now, not to the surprise of anyone who knows me, but to the surprise of some others, we declined.
Right.
And some people were outraged, but if you're going to take a stand, you have to take a stand. And you're not going to buy your way out of these kinds of situations. And the similarity in tactics, quite honestly, for me, in my experience, between the tobacco industry and the beverage industry, there's virtually no distinction between and among them. But that was some of our experience in Philadelphia. Gloria, what did you see in your work with the opposition? What kinds of things were they doing?
Well, for sure, I know when the former Navajo president vetoed, what had happened was that the Coke company sent one of our Navajo former leaders into the president's office the morning of the vote. And they told the president, we'll pay for your campaign if you will veto, this legislation. And sure enough, he went ahead and he promised us for 2 years he was going to keep supporting us. But yet when he got the offer from the Coke company to cover his political campaign, he reneged on us. And that was just terrible. Some other things I wanted to just make a quick comment about. Out on Navajo, we have maybe like 100 convenience stores, and then only 13 official grocery stores that has, the whole array of fruits and vegetables and everything, like in Albertsons or some of these other stores. We only have 13 of that, the size of West Virginia, which is so ridiculous. But those 100 convenience stores, we found out, we did a store study, and 80 to 90% of those stores were only selling junk food and soda pop. So Navajos didn't even have a choice. to buying quality food and quality drinks. So, it was appalling economically to look at those numbers. And so that's the issue right now we're working on. And so, we've had grocery associations starting to look at us and say, oh my gosh, we need to try and get in there and help with the situation. We're saying, well, stock our convenience stores with fruits and vegetables, please. That'll help us, and that kind of stuff. So there is some modest changes finally happening. And with COVID now, when a lot of our communities were locked down, they were not allowed to move out of their houses and communities. They did not even get a chance to go to the stores. And then the stores were closed. And then that pushed those Navajos out to what we call the border towns, those big cities around the reservation. And they had to stock up on food. And some of them had already lost their jobs. And so they couldn't even buy food. And then so President Nez started bringing in all the relief food groups and sending out boxes of food because of the pandemic situation. But that taught us a lesson that we need to go back and do our local growing of our own fruits, vegetables, and even our livestock. So we are revamping our whole food system. And, we're glad to do it now because it's only going to be healthier and economically better.
I want to continue to encourage our audience. You can get some questions asked and answered if you send them in to us. And Gloria, we actually, one has come in for you asking the question, did you consider taxing distributors directly rather than using a sales tax? A very technical question.
Yes, we considered that. And it came late in terms of our processing our legislation and working with our council. However, we decided that if the Navajo people wanted to really grasp the health issues, they need to contribute to the revenues in some fashion. And like I said, we just got that solution as a late recommendation. And so that's still an opportunity that maybe we can open up in the future. And we're now looking at maybe raising the 2% tax rate. But we struggled with that. At first, the council said only 0.5%. And we go, oh my gosh, that will do nothing. and then our study showed we need to have it at 8%. So we just had a big struggle because of economic factors out on Navajo that we survived with at least a 2%.
Part of our panel, part of our charge today, of course, is coming at the end of this summit, this last plenary. We want to send folks off certainly with not only some great experiences, but also lift up the great work. We've talked about some of the challenges, but I throw out to all three of you. Please share with us, what were the things that kept you driving? We've talked about the opposition from industry. We've talked about the politics and some of the elected officials, but what were you hearing from people on the ground? What the folks that really, really matter, the people who have the power, our citizens. What kinds of things were they saying when you were going through some of these fights? And this is for all three of you. I'd love to hear your take on that. Don't be shy.
Well, I'll jump in. I'll jump in.
Start.
So,
Okay.
Part of the work that we did was really connecting with parents as we were pushing this legislation forward, having a clear understanding of what their priorities were, what their concerns were. And it reminds me of something I actually heard you mention before, Mayor Nutter. It's the power of the story, right? Because the industry will battle us to the death when it comes to data. They have their own dietitians and physicians and all these other folks on their payroll. But what they cannot argue is the story. And so really being able to connect with parents and hear from them the struggles that they experience when they take their little ones out. I mean, in these COVID streets, as we say, trying to get our kids fed and maintain work now that we're 24/7 ever present, it's hard for working parents to be able to navigate through healthy meal prep every single day. And so
Yeah.
here in Prince George's County, where the majority of our food establishments are fast food, over 75% of our food establishments are fast food eateries that do not provide healthy options for our children. It was very frustrating for them. They felt bad giving their kid a Happy Meal, but it was either that or trying to stress out figuring out how to cook a meal at the house. And I get it. As a parent and as a single parent, I fully understand the challenges that exist in that space. And so being able to use those stories, have them speak to their council members to say, listen, on a Tuesday night when I have worked 14 hours, if and when I drive up to a drive-through at fill in the blank restaurant, I want to have the choice of a healthy meal, number one. Number two, I need some support. Any of you who are parents know that when you roll up to the Golden Arches and you try to convince your little one to get the healthier choice, now it's like, this is how it comes. Like they're giving us apple slices and some water. It's this, or, you get what you get and you don't get upset, is what I used to say when I taught elementary school. And so it makes the healthy choice the easy choice. And those were the consistent messages that we pushed out. And, in partnership, particularly with the American Heart Association and their Voices for Healthy Kids, they were able to capture these messages and use quote cards to push out in social media, to be able to share with our council. Because as I mentioned before, our county council was inundated with phone calls, meeting requests, emails, etc., from the industry. I'm not going to make any assumptions about whether or not they were offered some pay or not. I'm not even going to do that. But I know that they were ever present. And so we had to figure out how do we fight against that? They are the Goliath, but we are the Davids, and we know how that story ended. And we're happy to say that we had the final victory as well, but it was because we partnered with our community to allow them to have the voice to speak their lived experience, as opposed to it being a bunch of academicians and experts showing up to provide testimony.
Gloria Damonte, it's the same issue. What was happening on the ground while all this other battling was going on?
Well, one of the things I would like to add into this is just to say, our opposition, yes, we know it's the industry. Yes, we know it's the food industry. Yes, we know it's the tobacco industry. But our biggest opposition on the ground, in my opinion, was our own industry. It was the people, our leaders, that were taking money from these industries to support their arguments. Now that is very hard to deal with when you may have a pastor preaching from the pulpit that we don't need to have a ban on sale of mentholate tobacco products, or we don't need to support this sugary beverage, either the tax or menu. That's the killer, because these are folks that are on the ground, that the community knows, that the community listens to more so than the industry. So yes, the industry may have paid for this, but having those spokespersons from within our community on the ground, that's the biggest opposition that we fought, at least in tobacco, since 2009. And so how do you combat that? You have to combat that from within the community. You have to go and build the community capacity. You have to go and give them the facts. You have to go and give them the data so that they can talk out against each other. And so when you may have a pastor from the pulpit, preaching and saying it's okay to have the sugary drinks, it's your right, it's your privilege, and all this, you have to have another pastor that you've built their capacity that can come and speak to them and say, no, this is not true. This is what the industry is doing to us. This is what they've been doing to us all this time. And so that was our biggest opposition, because it was on the ground. Countered that by building capacity so that our community members could talk to those that have been taking money from those industries to support their causes.
Yeah. Gloria, you have some thoughts about that? What were the Navajo people saying? Not the industry folks or opposition. What were the people on the ground saying?
Well, we went to a lot of, like I said, the chapter meetings. We have the 110 chapter communities, and we went actually to 49 of the 110. I tell you, we were carpooling, eating peanut butter sandwiches on the way, and it was quite a chore to get out to those 110 communities in this vast landscape. And when we were listening to the community people, they were voicing, all these health disparities. And when you know that near 30% of our people are diabetic, and they have relatives and family and friends that are suffering with these different chronic diseases, everyone started agreeing, oh my gosh, let's look at this issue. How are we going to help it? How can we really turn this health issue around, and where are the solutions for us to take care of ourselves?
Yeah.
And the other notion was that they did really support us once they were educated on the health disparities. And at that time, we have a lot of our healthcare services with federal government hospital services called Indian Health Services. And it just so happened that we could show health data of increased numbers of our Navajos becoming obese and having cancer and heart attacks. And yet the federal government was cutting our health budgets down, closing down our emergency centers, and that kind of stuff. And then that's when the Navajo Council woke up and said, "Oh my gosh, if we can't, have federal health services, we better try to help ourselves be better, health providers and help get the health monies out to the communities in a lot better fashion."
Yeah.
So, yeah, it was a number of different things that our
Sure.
people really reacted to and tried to address to help themselves. And that was a wonderful behavior change that happened.
What I've heard, a thread line, if you will, through all of your responses was the need for education. I don't tell people what to eat, what to drink, or all these things. But I think when folks are better, when they have more information, when they can find the legitimate sources of information and educate themselves, more oftentimes than not, they actually will make the healthier choice. When we faced down both of these industries during my time, it was fact based. It was information that people needed to have. And whether during my administration we were successful or not, we actually saw a reduction in the purchase of those beverages. But more importantly, we actually saw a reduction in overweight and obese conditions by adults and children in the city of Philadelphia, even during the time we didn't have a tax in place, just because we were providing more information. We had a full-blown ad campaign that was partially paid for by the CDC. We helped people to better understand that, in my opinion, soda is literally one of the most useless products ever created that you could put in your body. It has no nutritional value, provides nothing to you, and actually can harm you. I think it was I had on my desk in the office as mayor a bottle of Mountain Dew. I think it might have been a 20-ounce bottle. If my memory serves me correctly, I think it has 73 grams of sugar in it. And I would have a bottle on the desk and like 20 packs of sugar. You have to help people to understand what it is that inadvertently they may be doing to themselves, but certainly the industry is trying to do to them. And again, the economics, it was going to damage the city's finances, companies were going to close, people were going to lose their jobs, none of which was true. But they create an environment and a hysteria almost to cause, like smart people, legislators, sometimes not to make the right decision. Dr. Hancock, you obviously are actively involved in the DC soda tax. Tell us more about that.
Yes, so we just recently introduced the Nutrition Equity Amendment Act, where with funding from a 1.5 cent per ounce excise tax, funding will be dedicated to improving nutrition equity within the District of Columbia. The funding from this excise tax will be committed to nutrition education in the pre-K through elementary grades as it relates to teaching little ones how to make healthier food choices. Funding will be dedicated to family-based transition shelters with families who find themselves in a homeless situation. It will provide them not only with healthy food options, but with food, nutrition education, cooking classes, all of the things that are necessary to help address the chronic stress that a lot of people of color experience and facilitate the development of these chronic diseases, but particularly in the space of having housing challenges, right? There's no worse stress than not knowing where you're going to rest your head, have your food, or allow your children to be cared for. So to be able to provide a safe space for them to live, and on top of that, provide nutritional support, as well as the investment in communities of color, particularly Black-based nutrition businesses, to allow for a greater concentration of healthy food options east of the river in Wards 7 and 8, which are the wards most disproportionately impacted by all of the chronic diseases that we've discussed here. And with this excise tax, our goal is to also, in addition to providing all this support for these nutritional resources, is to reduce sugary drink consumption so that we can directly impact the health outcome for our communities of color in the district.
Thank you. Thank you.
And let me, Mike, if I
Go
can
ahead.
add on to
Go ahead,
that, and I know I'm not there in Maryland, but I'm just looking at one of the questions that was in the chat that was just talking about the regressivity tax, and this is exactly what Dr. Yola just said. In terms of a tax, there's a tax on this product. There's a tax on this product that you shouldn't have anyway. And what we're trying to get you is away from this product to something healthier that's not taxed. And so it's the same thing with tobacco. Whenever our argument there was, well, wait a minute, we're taxing it so that you don't smoke it, so that you don't use the product. And so that's why we're having this tax on it. And so folks said, well, this is going to hurt communities of color. No, it's going to save their lives is what it's going to do.
Right. It's a short term versus the long term. I mean, why is a bottle of cold water in some places actually costs a little more than a bottle of soda?
Right.
The water
but the regressivity argument goes up
the water is produced by the same companies. Right? I mean,
same company.
They're making money one way or the other.
Yep.
Go ahead, Doc.
Right.
I'm sorry.
I mean, but this notion of regressivity comes up often, and I acknowledge that a sugary drink is going to cost more, and disproportionately communities who are resource challenged will pay more based on their income ratio, right? Like I grew up resource challenged where my mother used food stamps out of the booklet, not the EBT card. So I get it. There's no more regressivity than the disproportionality of diabetes, heart disease, high blood pressure, and early death in the Black community. When we talk about stories, and this is what makes I get emotional. I took care of a 9-year-old child who lost both her mother and her father in their 40s to diabetes. And her 70-something-year-old grandmother had brittle, unstable diabetes, trying to take care of her brother, this 9-year-old, and her sister. And in one visit, I had to diagnose all 3 siblings with diabetes. There is nothing more regressive than Black people dying in their 30s, 40s, 50s, nothing more regressive than Native Americans and Latinx community members dying before they can even envision reaching their 50s, not because we are genetically inferior, but because soda and the beverage industry and the medical community, if we're honest with ourselves, benefit off the broken and dying Black and brown bodies. And so when people talk about regressivity, I want you to calculate out how much it costs Black families when one of their loved ones is diagnosed with one of these chronic diseases, and compare that to a 1.5% excise tax on a soda that we shouldn't have been introduced to in the first place. When my family, my ancestors worked in the sugar canes of Louisiana and literally broke their backs to make the Coca-Cola that kills us today, that's regressive, not an excise tax.
And that's
not an excise tax. And and then the other thing, just looking at that other question again, another question talking about dealing with health equity and racial disparities. Let's get this right. Yes, warning labels and SSB and the taxes on those are all great things in terms of dealing with it. But you have to look at the whole content and the context of health equity. You have to look at communities. If you're going to say we want to address this, we want to have warning labels on these products, you got to ask the question right now, which restaurants, where are they located that have the healthiest food options and the healthiest food choices you can have? Are they located in communities of color? Are they located on reservations? Are they located where the communities that need them can readily have access to them? Are they affordable in those places that they're located in the communities that really need them? If they are not there, if they're not in the communities, if they're not affordable, then we have to think of other options. We have to think of, well, wait a minute, what is at these places? How do we make the meals that are at these places healthier? How do we make them affordable? Because the healthiest restaurants for where I live are not in the neighborhoods that I live. They're across the railroad tracks on the other side of the tracks. That's where they're located. So I got to drive over there and then get the healthy food. So we have to think about it in context of health equity.
Mhm.
Yeah, because when we did our store study, we were seeing our Navajo people travel 100 miles one way to go get food. And those were, of course, again, the border towns that had the nice big stores, and they have the vegetables and the fruits and the good stuff.
Wow.
So we have been really looking at all avenues of how do we access food.
So I want to be mindful of our time, and we still have to get our president on. But I want to ask each of you to give us, we really want to send off our participants, our viewers today. We want to send them off super excited, super charged up. We know about some of the challenges out there, but you all have not only talked the talk, you've walked the walk, and you continue doing the work out there. So in the same order that we introduced you, Dr. Hancock, give us some positive words to begin to close out our plenary session on. Give the folks a word.
Absolutely. The first thing, as I started with, is partnership, understanding what you or your organization's strengths are, but first starting in the community. The work that we collectively have done would not have been successful without partnership and prioritizing the community first. That's the first thing that we do. We recognize the tactics that the industries will put forth to fight us. But as I mentioned before, they may be the Goliath with the resources and the funding, but with the will of the people, the power of voice, and the beauty and uniqueness of our lived experiences and our stories, there is nothing that we can't achieve. It's providing the education and facilitating the empowerment. It's not that people are voiceless, it's that people choose to refuse to listen. So when you create, we as these professionals, create space in communities where otherwise they felt like they were not listened to, whether they're in support of your legislation or not. It's important to have those conversations so that you fully understand the community's viewpoint. Once you do that, it's full steam ahead and you will be successful.
Gloria?
I don't know. We have a very good story out in Navajo country with our junk food tax, and to see the children able to go to now playgrounds and to be educated better on how to cook and how to look at nutritional value foods, and people a lot more happier, and they're willing to try all kinds of avenues, all these health projects. Like I said, we had more than 1,300 projects made in our 110 communities. And when we do our fun runs and we can provide nutritious refreshments and educate some more, it's the people that are looking healthier and happier is the best outcome I can say with what we've been doing out on Navajo.
Del Monte, 20 plus years, been in the fight. Give us a
Oh,
word.
yes. A word. The theme of this conference here, building community, building health. Well, that hits it right on the head. Building community capacity is the best thing that we can do. It's giving them the information, it's giving them the knowledge so that they can advocate for themselves. We don't have to go in and advocate for them if we build their capacity to advocate for themselves. Now, what we can do is we can help develop their infrastructure. We can help make sure that they've got the resources, they've got the staffing, they've got the personnel, they got the know-how to do the things that they need to do. our communities are our greatest asset. They always have been, they always will be, and they are resilient. They will survive this. And so we just need to support their infrastructure and help to build their capacity so that they can build their own community health. That's it.
Dr. Hancock, Lori Begay, Del Monte Jefferson, it's been a pleasure to be with you. And to all of our audience, let me just say, I want to reinforce every one of our panelists talked about their connection or relationship with CSPI. I had my own when I was a member of City Council and as mayor of the city of Philadelphia. There are a number of great champions out in communities all across the United States of America, but certainly one of the strongest is the Center for Science in the Public Interest, CSPI. And when CSPI is on your side, you're going to have science, you're going to have data, you're going to be on the right side of the issue. And over time, you're going to be successful because that's what CSPI is all about. Thank you so much for being with us today. And I'll turn you over to our president.
Gosh, I don't even know how to follow that, Mayor Nutter. Thank you so much, and thank you to the entire panel in that last one. It's just extraordinary, so moving, so inspiring. So thank you so much. So this is the sad moment at the end of a conference where we get to say thank you to everybody and goodbye. I want to thank all of our speakers and participants who have shared their expertise and their experience with all of us. And to all of you, we deeply appreciate your investment of time, of energy, leadership, and ideas. A special thanks to Bloomberg Philanthropies for their support of CSPI's work to engage communities in reducing SSB consumption and improving health through policy initiatives. And a special note of appreciation to our visionary and hardworking CSPI team for this event. Here they are, and I want to call out particularly Nancy Fink, who helped with the real groundwork on pulling this together. Geetja Mystery, Katie Walks, Mia Cabello, Catherine Scheck, Jeff Cronin, Richard Adcock, and our theoretician and manager, Laura McCleary, who had a lot of the ideas behind this. They were joined by many others on the team as well, who appear on the current slide, and they kept everything running smoothly and solved problems for our speakers. Here they are, and I'm not going to go through all of them because it's such a large team, and that's what it takes to put on an event like this. I also want to thank our CSPI board members, Mayor Nutter, who you just heard from, and Mary Bassett for their terrific contributions, and to the conference facilitators, Conference Direct, for keeping a complex operation working so smoothly and on time, even during a pandemic. It takes a whole team to pull something like this off and have it go as well as this. So I look back, over the last 3 days, I've just learned so much from all of you. It began, with our opening set of remarks. We heard from Mark Bittman along with Jane Black. I was especially interested in the Science Policy Research Forum that I thought was very compelling and brought us all up to date. And then this final session that was just so immeasurably moving and touching. We brought you a multimedia event as well. You saw Tay Spate's video, and then we all gathered last night to watch the El Susto movie, and that was a great experience as well. So we look forward to working together in the coming months and years. We're going to start off with Lobby Day tomorrow, and thank you to all of those who signed up. Now, to keep the momentum going, CSPI is launching a new training series that will continue these important conversations and support the work of our partners and grantees in the field. The series will include webinars on a wide variety of topics and discrete trainings on communication, storytelling, power mapping, and much more. You'll be hearing from us as these events come near. So to kick it off, we wanted to mention 2 upcoming events over the next couple of weeks. On April 29th, from 3 to 4, we'll be hosting Lobbying 101 with Colin Schwartz, who you've all come to know during this meeting. And we'll have a webinar on the National Salt and Sugar Reduction Initiative which will be on Tuesday, May 4th from 2:30 to 3:30 Eastern Time in the afternoon. We hope you can join us for these. If you have any thoughts on other training topics that would be useful for your work, please share them with us when you receive the post-summit evaluation survey. Mostly events like this make it clear that we are all in this together and that we can build and rebuild community health through sugary drink policies and advocacy. We are not alone in this fight. As this conference shows, our friends are across the world, and together we are facing down industry tactics and we are winning. Advocates at home are mobilizing action across their communities to drive policy changes that improve public health. It's also clear that this is our time to kick our community campaigns into high gear, our time for the communities to tell their stories and build power for policy change. In this work, we hope to support you, and we pledge that CSPI will work alongside you in the community as we, working together, put public health where it belongs, at the forefront of the national agenda. Thank you so much for joining us, and I look forward to the next time we can all be together. Bye.